Good morning. Since the report Vision Problems in the U.S. was first published in 2002, Prevent Blindness America and the National Eye Institute have been coordinating efforts to capture and report the prevalence of adult vision problems. Beatriz Muñoz is an associate professor in the Department of Ophthalmology at Johns Hopkins University. She will discuss the most recent updates to vision problems in the U.S. Professor Muñoz.
Good morning. Today I'm going to present a brief summary of the update on the prevalence of the major eye diseases that affect the population 40 and older in the United States. These diseases are responsible for most of the blindness and the visual impairment, and I am going to present estimated numbers of persons blind, persons visually impaired in the United States in 2010 with projections to 2030 and 2050. Prevent Blindness America and the National Eye Institute invited principal investigators from the major population-based studies in vision to come up with estimates of what was the burden of eye diseases in the United States. In this slide are the major collaborators. Dr. Coleman and Dr. Friedman are responsible for the current update. So we know that vision from macular degeneration, glaucoma, and diabetes could be prevented or slow or progression of vision loss. To have adequate resources and treatment, it's important to know with certain precision what is the burden of the diseases. In 2004, 2003, 2004, there was a general estimation of the number of people blind and visually impaired in the United States. In this presentation, I am using data from the Census 2010 for the National Interviews Survey 2010 to update these numbers. As we all know, the population of the United States is aging. In 2010, 40 million were 65 and older, and almost 6 million were older than 85. By 2050, the population 65 and older is going to double, and the population 85 and older is going to be more than 3 times what it is today. With that in mind, the process that we followed to estimate the burden of disease was to identify large population-based studies, obtain primary data from the investigators, and combine this data using meta-analysis techniques in mathematical modeling to come up with the estimators. Details of the statistical analysis done had been reported in previous publications. These are the studies that contribute with data for these calculations. In addition to these studies, there were 2 studies that were specific for diabetes that contribute to the diabetic retinopathy component. Let's start with macular degeneration. We are going to concentrate in the severe form of macular degeneration, which is geographic atrophy and neovascular disease. Macular degeneration, once vision is lost, is permanent. You cannot restore vision. However, in a recent clinical trial, the National Eye Institute demonstrated that a high dose of vitamins can reduce the vision loss by almost 30%. And currently, there are some treatments that are very promising for the late stage of macular or neovascular disease. So in this presentation, I am going to refer to macular degeneration as having either geographic atrophy or neovascular disease. This is the prevalence of macular degeneration for whites and blacks in the United States. As you see, it increases with age, and there is a huge increase after 75 for white Americans. For the group 80 and older, almost 14% of the whites will have macular degeneration, and 2% of the black Americans. If we translate these two numbers using the 2010 census, we estimate that currently we have 2 million people affected with macular degeneration. The majority of them are white. By 2050, the number is estimated to be more than 5 million people, and more than 90% of them will be white Americans. The left panel shows an optic nerve of a normal eye. The right panel shows an optic nerve that has been affected by glaucoma. Here we have glaucoma is characterized for peripheral vision loss. Here is an eye that is normal. With glaucoma, the eye starts to lose vision, and this is an eye with mild glaucoma, and this is an eye that has been damaged and is blind by glaucoma. So to estimate the prevalence of glaucoma, we use several studies. They do have different definitions, but they do have something in common, is that they require visual field loss and they require optic nerve damage. None of the studies use intraocular pressure to define glaucoma. The prevalence of glaucoma is dependent on age. It's much higher in blacks than in Hispanics or whites. By age 40, 80 or 12% of the African Americans and around 6% of the whites will have glaucoma. When we translate that into numbers, we have that almost 3 million people is estimated to be affected by the disease in 2010, and that number will increase to almost to more than 6 million by 2050. To notice is that the blacks will contribute disproportionately to the number of people with glaucoma, and by 2050 you could see that the Hispanics and blacks contribute with the same number. This is due to the faster increase of the Hispanic population in the United States. With age, the lens becomes opaque and the light rays are blocked, producing vision loss. There is no preventive therapy for cataract at the moment, but the good news is that surgery is highly successful at restoring vision. The studies that we used to estimate the prevalence of cataract, all of them used photographic documentation of the lenses. And although they used different grading systems, there was a way to create some equivalences. This is an example of the studies that use the log classification system, and a cataract was defined if you have a nuclear opacity that was greater than the standard 4, greater or equal to the standard 4, a cortical opacity that will cover at least a quarter of the lenses, or if 3% of the lenses were affected by PSC. This is the prevalence of cataract in the United States. As you see, the prevalence of cataract is very similar by race. It's highly age dependent, and for people 80 and older, more than 60% of them have cataract. If we translate this into numbers, we have 25 million of people in 2010 with cataract, and by 2050, the number will increase to 50%. I should stress here that these projections are assuming that the trends are stable and constant. If the trends do change, these estimates may change too. Now, for diabetic eye disease, we are going to include in diabetic eye disease both macular edema and diabetic retinopathy. We know that diabetic eye disease often affects working age individuals. Blindness is preventable in most of the cases, and, but the disease is asymptomatic, so it's essential to have periodic eye exams to be able to treat severe disease. The data presented here is for the presence of any diabetic retinopathy. To do this estimation, we have to do a two-step process. First, we needed to estimate the number of people with diabetes. To estimate the number of people with diabetes, we use the National Health Interview Survey. The estimates are from the 2010 survey. The prevalence of diabetes between 2000 and 2010 in the United States increased. So the numbers that changed the most between the first report and this report are the ones due to diabetes. The projections that we made are assuming that after 2010, the rates of diabetes are going to be stable over time. That's a big assumption. And the consequence of this is that we may be underestimating the number of people with diabetic retinopathy in the future. So here is the presence of any retinopathy due to diabetes. What we see here is that for whites and blacks, the prevalence are quite similar, and there is no dependence on age. However, for Hispanics, the prevalence are much higher, and we see an age dependence. These are the estimated number of cases of diabetic retinopathy. In 2010, we estimated that almost 8 million people will have some retinopathy due to diabetes, and by the year 2050, that number will increase to almost 14 million. So this is the situation in 2010. There are 7.7 million with any retinopathy. If we look just at the group that have the group of people 40 and older that have diabetes, 40% of them will have some retinopathy. If we translate that to the general population, it's around 5% of the general population have any retinopathy due to diabetes. In terms of vision-threatening retinopathy, we have 1.7 million of Americans that have this condition. If we just look at the group 40 and older that had diabetes, almost 9% of them will have retinopathy that is severe enough to treat in vision. In the general population, this is around 1% of the general population, 40 and older. We define visual impairment as having best corrected acuity in the better eye worse than 20/40. It's very difficult to assess causes of visual impairment because usually more than one process is going on. The prevalence of visual impairment, as we expected, increased with age. Before age 75, blacks and Hispanics have higher rates of visual impairment. However, in the older ages, the rates tend to be similar. What is important to notice here is that after age 75, the slope of the increase in prevalence is really steep. So we will have a lot of visual impairment in the 80 and older. In terms of absolute numbers, we estimate that we have over 4 million people with visual impairment in the United States in 2010, and this number will increase to 13 million people by 2050. If we look at blindness, we define legal blindness as best corrected acuity 200 or worse. As with visual impairment, several diseases could play a role in the visual impairment. However, we were able here to identify primary causes. In terms of absolute numbers, right now we have 1.4 million people that is blind, and by the year 2050, if the trends continue to be stable, we will have a little bit over 4 million people blind. So if you looking at the causes, cataract and glaucoma account for half of the blindness in the blacks. In the white population, AMD accounts for almost two-thirds of the blindness. So in summary, the leading causes of blindness vary by race. AMD is the most important cause in whites. Glaucoma and cataract are the most important causes in blacks, and it's less clear for the other racial groups. There are 4.2 million Americans visually impaired in 2010, 1.3 million that are blind, and if the trends continue to be the same, we expect to have 13 million people impaired in 2050 and 4 million blind. So the challenge is to reverse these trends to decrease the burden of disease due to visual impairment, the burden of visual impairment.